Good morning, all of you. Thank you very much for the kind introduction by the chairperson. Dr. Mohan has made all of you so sweet without adding sugar. But now I'm here to make you all go nuts. Really, my job is to make you all go nuts in the next 20 minutes of my presentation, and I plan to do so by cracking the evidence of nuts and metabolic risk. The study has been, various studies that I'll be showing has been sponsored by Cashew Promote Council, Export Council, Ministry of Commerce, and Almond Board of California, American Pistachio Growers. And however, the same study design, conduct, or data analysis, they had no role at all. My outline of my talk, some basic recap about nuts introduction and their nutrition important profile, and consumption patterns today in our country with an epidemiological evidence, and then challenges today with the nut consumption and how we did clinical trials at MDRF, and how to incorporate nuts if the findings are so good, how to go about taking nuts, the tips, and of course summary and conclusion. What are nuts? Nuts are actually fruits, and they are single-seeded fruits and have high fat content. So they formed a new category, nut. The tree nuts, they call it, mainly all the nuts, almond, cashew, pistachio, macadamia, pine nuts, Brazil nuts, pecan, and all of that stuff. But peanut is not a nut. Thanks, Dr. Anuj also mentioned under legume, and it's a legume. And coconut, people always ask about coconut. Is it a nut? It's neither a nut nor an oil seed. Coconut oil is made from the fleshy part. It's not made, the oil is not made from the seed. And coconut is a drupe. It's a kind of a dry fruit. So, now the nutrient profile, I'm going to highlight the features. I've taken these three common nuts that we consume in India, most predominantly. And if you take cashew, almond, and pistachio, pistachio has got higher protein and compared to cashew and almond has got the least amount of carbohydrate of 3%. As compared to cashew 25 and 15%. You will see how they are reacting in the clinical trials. And the total dietary fiber, the almond has got higher, and total SFA, cashew has got higher saturated fat, and I'll tell you where. And the MUFA, of course, almond has got the highest, and total polyunsaturated fatty acid, predominantly N6, and it's the least in cashew nut compared to almond and badam. Of course, all nuts, because of their high fat content, they are all low in glycemic index. In addition to that, we all know that nuts have got micronutrients and phytonutrients. It's really fight with a disease condition. So that's a phytonutrients. And you have all the tocopherols, polyphenols, and all of those. And micronutrients, particularly magnesium and calcium, is very high in zinc as well. Now, the current consumption of epidemiological evidence. This is our first study from Chennai urban-rural epidemiological studies way back in 2003 to 2005 we conducted, where we have shown 23 gram, it's nuts and oil seeds. Oil seeds like sunflower, safflower seeds, gingerly seeds, all of them. That together it was 23 gram and 4.3. And 2011 and 12, ICMR did NNB, National Nutrition Monitoring, where they showed urban and rural, 8.99 grams in urban and rural. You might wonder, oh, does it mean that from 2005 to 2011 and 12 they have reduced so much? It is not. It is due to the methodological difference. This is also nuts and oilseeds. Our CURE study, we measured the dietary habits of the population from food frequency questionnaire, which usually asks last 1 year, what was your nut consumption pattern. Whereas NNB did just single one 24-hour recall. Just what did you eat yesterday? You might not have eaten nuts at all. So it could have underestimated in single 24-hour recall, and usually FFQ little overestimate. But it's good to discriminate and rank the population. The food frequency is always a better one. And in 2025, still INDAP, the last part we have done, and there again we have got, in INDAP 2021, we have separated nuts separately, oil seeds separately, because the oil seeds goes together, and nuts as a food group with so much of phytonutrients. This is only a nuts, that's why you see it's around 12 gram both in urban and rural. The two are nuts and oil seed. Now, we are the nut of the last order, right? eating so less. Now we have to go to the nut of the first order. You have to really eat to the recommended guidelines that NIN has launched last year, 30 to 35 grams for non-vegetarian and vegetarian together. How do we go about to go nuts for health? This is where the big challenge comes for the nut consumption. So when we have to start way back very early in 2014 or so to start the study, what are the struggle? And literally Dr. Mohan has to be a guarantor for all the nut studies, I can tell you. And this is the first time when we started with cashew nut study, we literally cried. Dr. Mohan, all participants are very scared, type 2 diabetes. They are saying, cashew